I want to simply start with this talk, and we here had the aim in this study to compare the gadolinium-based high relaxivity contrast agent P846 with a standard extracellular gadolinium chelate Gd-DTPA for contrast-enhanced MRI at 9.4 T in rats with hepatic colorectal cancer metastasis. P846 is an experimental compound from GÖB research. It consists in a macrocyclic 3-armed chelate with the gadolinium ion centered here in the center of this complex, and we have these 3 bulky side chains. We have a rather high molecular mass, which is around 3.5 kilodalton, and subsequently we have really high relaxivities, especially for low field strength or clinical field strength like 1.5 T and 3 T, which are 32 per millimolar and per second or 24 per millimolar and per second. And this is like 8 folds higher than the gadolinium DTPA complex. For higher field strengths, such as 4.7 T or 7 T, the R1 relaxivity drops, but still we have here like 4-fold higher relaxivities with 15 or 11 per millimolar and per second. We already tested P846 in a rat brain glioma model a couple of years ago, and we here compared it with gadolinium DOTA applied at a dose of 0.1, and we used P846 at a dose of 0.025, which is actually the recommended dose. And what we saw is that we have a comparable enhancement for P846 with only 1/4 of the clinical dose. So in this study, we applied another model. We had 9 rats which received an injection of colon cancer cells into the left liver lobe in order to induce a focal liver lesion. And 12 to 14 days after the tumor induction, we performed MRI with our 9.4 T animal scanner using a dedicated 16-channel volume coil. And we performed all experiments under general anesthesia with isoflurane and oxygen. We applied both contrast agents intra-individually in a random manner, and we considered gadolinium DTPA at a dose of 0.1 as a reference, and we applied P846 in this study at an equal dose of 0.1 millimole per kilogram body weight intravenously. We basically started with T2-weighted rare sequences in order to detect the tumor, which is sitting here in the left liver lobe with a size of approximately 1 centimeter. And then we acquired in the second step the T1-weighted sequences in axial slice orientation covering the area of the tumor. And the T1-weighted sequences were based on a retrospectively self-gated flash approach with an acquisition time of around 1 minute and 32 seconds. And we acquired, of course, unenhanced scans and 10 consecutive sequences after the contrast bolus injection. We measured signal intensities in the livers and the tumors based on ROI approach, and we calculated after that the SNR, the CNR, and the lesion enhancement based on these equations here.